Okay, we've touched on, I suppose, some of the key issues there around, I suppose, housing and homelessness, and I suppose in regard to healthcare support as well. What's the situation down in Cork? In the areas that you are you seeing people? Sorry, are you seeing hospitals that are kind of being clogging up the whole time? People on waiting lists and that as well. Is that another key issue down in Cork too?
Well, in Cork, at the moment, all the GP visits, the doctor is have to be moved into St Mary's, which is up in the orthopaedic there, on the north side, and it's after putting a lot of strain on services because it's throwing the problem rather than giving the proper supports and funding to these GP visits. Sorry, I have to lose my thought now.
Good again.
No, so yeah, up in there's a new development in St Mary's which is called the orthopaedic, and up in the north side, and GPs and physios and everything else is located in the one area, which is ideal in one sense, the fact everything is so close. But what they're actually after doing is that they're after putting services which are very overstretched, under resourced into one area, which is after making things more chaotic up there. Because at the end of the day, by putting overcrowded GP care and on top of everything else is not a solution, and that's what the local council and the government are after doing in terms of GP in the north side. And then you have the CUH, which is overrun. The A&E is constantly packed 24/7. The average waiting list in A&E is about 6 hours to get seen, and it's actually ridiculous, and then there's a lot of stuff that could be done and again in a community setting that's not being done, such as elderly people that could maybe get the supports from home or with a carer, that doctors and GP visits needs to be more supported in order to do house calls, and also to look at maybe young children as well, because young kids, as we all know, in A&E it's not something that parents want to go through, and we need to maybe have that in a more quick turnover as well, because it's not fair on our young people and our elderly people to be waiting in these long queues to get seen, when these supports can be done locally within the community. And the GP has been visits have been slashed as well, so that needs to be looked at locally, because it can improve our health care system and the efficiency of how that would operate the A&Es, and it will have a huge impact in terms of the people, and would reduce waiting lists. But again, the number of beds that people are waiting on is another issue that we need another hospital in Cork City. But what has been done, they actually closed two. It was the South Infirmary they closed, and they closed the St Finbarrs and the South Infirmary they've closed. And if they're not closed, they might be used for outpatients and that kind of stuff. These are two perfectly good hospitals. We could maybe renovate or maybe develop them and maybe upgrade them a small bit, but I don't see why they have closed them.
Yeah, it's I suppose given the crisis that's there at the moment, to be shutting down hospitals almost seems counterproductive. But I suppose that's the situation we're in.